Nearly 1 in 2 people. That's how many of us will face a cancer diagnosis in our lifetime. Cancer touches so many lives, but how much do we really understand about the treatments? Understanding these treatments is crucial. It empowers us. It's about facing a challenge with knowledge and hope. When we understand our options, we can make informed decisions. We become active participants in our health journey, not passive bystanders. Think of it this way. Imagine you're about to climb a mountain. You wouldn't just start hiking without a map, the right gear, and some knowledge of the terrain. Cancer treatment is similar. It's about giving you those tools. It's about empowering you with the knowledge to face this challenge head-on. In this comprehensive guide, we'll explore the different types of cancer treatments available. From traditional approaches like chemotherapy and radiation to cutting-edge therapies like immunotherapy, we'll cover it all. This isn't just about listing treatments, though. It's about understanding the why behind them. It's about giving you the confidence to ask the right questions. Let's equip ourselves with the knowledge to fight back against cancer. Chemotherapy. It's a word that often evokes strong emotions. Chemotherapy has been a cornerstone of cancer treatment for decades. It uses powerful drugs to target and kill rapidly dividing cells in the body. These drugs act like tiny warriors, circulating through the bloodstream and attacking those fast-growing cancer cells. Chemotherapy is often used to treat a wide range of cancers. The goal is to either cure the cancer completely, shrink the tumor, or slow down its growth. It's a powerful tool in the fight against cancer. Imagine a garden with beautiful flowers and pesky weeds. The weeds represent cancer cells, growing rapidly and taking over the garden. Chemotherapy acts like a powerful weed killer, targeting those fast-growing weeds. It can also impact healthy cells in the body. Chemotherapy drugs work by interfering with the cell division process. Doctors carefully select the most effective drugs based on the specific type of cancer. While chemotherapy can be highly effective, it's important to be aware of potential side effects. Because chemotherapy can impact rapidly dividing cells, it can lead to side effects like hair loss, nausea, and fatigue. The good news is that not everyone experiences severe side effects, and there are ways to manage them. Anti-nausea medications can help alleviate nausea, and growth factors can help boost blood cell counts. It's essential to communicate openly with your healthcare team about any side effects. They are there to support you throughout your treatment journey. Radiation therapy. Unlike chemotherapy, which travels throughout the body, radiation therapy focuses its power on a specific area. Think of it like a highly focused beam of light zeroing in on the tumor with incredible accuracy. This targeted approach helps to minimize damage to surrounding healthy tissues. Radiation therapy uses high-energy waves to damage or destroy cancer cells. It's often used in conjunction with other treatments, such as surgery or chemotherapy. Imagine a magnifying glass focusing sunlight onto a single point. Radiation therapy works in a similar way, using high-energy beams to target cancer cells with pinpoint accuracy. These beams are generated by a machine called a linear accelerator. The patient lies comfortably on a treatment table while the machine delivers the radiation beams. The treatment itself is painless, similar to getting an X-ray. Depending on the type and stage of cancer, radiation therapy may be given over several weeks. While radiation therapy is a highly targeted treatment, it's essential to be aware of potential side effects. Patients may experience side effects such as skin irritation, fatigue, or hair loss in the treated area. The good news is that these side effects are usually temporary and tend to subside once treatment is complete. Healthcare providers work closely with patients to manage and alleviate any discomfort. Open communication with your healthcare team is crucial throughout the treatment journey. By discussing any concerns or side effects, you empower your healthcare providers to provide the best possible care. Immunotherapy. While chemotherapy and radiation therapy directly target cancer cells, immunotherapy takes a different approach. It empowers the body's own immune system to recognize and destroy cancer cells. Think of it like this. Our immune system is like a highly trained army, constantly patrolling our bodies for invaders. Immunotherapy acts like a wake-up call for the immune system, alerting it to the presence of cancer cells. This revolutionary approach has shown remarkable success in treating a wide range of cancers. How immunotherapy works. Boosting the immune response. Imagine a lock and key. Cancer cells often have proteins on their surface that act like locks. Immunotherapy drugs work by either blocking these locks or by providing the immune system with the right keys. Some immunotherapy drugs, known as checkpoint inhibitors, block the signals that cancer cells use to hide from the immune system. Other immunotherapy drugs, such as CAR T-cell therapy, involve collecting the patient's own immune cells and genetically modifying them to recognize and attack specific proteins found on cancer cells. Immunotherapy offers a promising new frontier in cancer treatment. Different types of immunotherapy. A personalized approach. Immunotherapy isn't a one-size-fits-all approach. There are different types of immunotherapy, each working in unique ways to harness the power of the immune system. One type of immunotherapy is called immune checkpoint inhibitors. Another type is adoptive cell therapy, which involves collecting and modifying a patient's own immune cells. Cancer vaccines are another promising area of immunotherapy research. Side effects and future directions. While immunotherapy offers tremendous promise, it can also have side effects. Because immunotherapy works by stimulating the immune system, it can sometimes cause the immune system to attack healthy tissues. These side effects are typically manageable and often less severe than those associated with chemotherapy or radiation therapy. The field of immunotherapy is constantly evolving, with new discoveries and advancements emerging all the time. The future of immunotherapy is bright, offering hope and possibilities for a future where cancer can be effectively treated. Emerging therapies. These two words hold immense power in the fight against cancer. They represent the cutting edge of medical research. Emerging therapies offer a glimpse into the future, a future where cancer could become a manageable, even curable condition. These therapies often target cancer cells with greater precision, minimizing damage to healthy tissues. From CAR T-cell therapy to gene therapy, these groundbreaking therapies are pushing the boundaries of what's possible in cancer treatment. CAR T-cell therapy. Imagine taking a patient's own immune cells, supercharging them with the ability to recognize and destroy cancer cells, and then infusing them back into the patient's body. CAR stands for chimeric antigen receptor. Doctors collect T cells from the patient's blood and genetically modify them in the laboratory. These modified T cells, now armed with the ability to recognize and target cancer cells, are multiplied in the lab and then infused back into the patient's bloodstream. Once inside the body, these CAR T cells act like guided missiles, seeking out and destroying cancer cells with remarkable precision. Gene therapy. It's a term that has long captured the imagination of scientists and the public alike. The idea of correcting faulty genes to treat or even cure diseases has been a tantalizing goal for decades. Gene therapy is emerging as a promising new frontier in cancer treatment. Cancer, at its core, is a disease of the genes. Gene therapy aims to correct these genetic errors. One approach involves using viruses as delivery vehicles. These modified viruses act like Trojan horses, delivering their genetic payloads directly into cancer cells. Emerging therapies hold immense promise in the fight against cancer, offering new hope and possibilities for patients who may have exhausted other treatment options. While still in their early stages of development, these therapies have shown remarkable success in clinical trials, leading to long-term remissions and even cures in some patients. However, it's essential to remember that emerging therapies, like all medical treatments, come with potential risks and challenges. Some of these therapies are highly complex and can have significant side effects. Access to these cutting-edge treatments can also be limited, and their high cost can pose a barrier for many patients. Despite these challenges, the field of emerging therapies is rapidly evolving. Scientists and clinicians are working tirelessly to refine these therapies, making them safer, more effective, and more widely accessible. The future of cancer treatment is being shaped by these groundbreaking innovations, offering hope for a future where cancer is no longer a death sentence, but a manageable, even curable condition. Amidst the complexities of cancer, breakthroughs shine brighter than ever. Recent years have seen incredible advancements leading to new treatments and improved outcomes. These are giant leaps forward, fundamentally changing how we fight cancer. It's a testament to the dedication of researchers, clinicians, and patients. Today, groundbreaking advancements bring remarkable success stories and hope. Section 2. Immunotherapy's triumph, the melanoma success story. One of the most striking examples of recent breakthroughs in cancer treatment lies in the realm of immunotherapy, particularly in its success against melanoma, a deadly form of skin cancer. For years, melanoma was notoriously difficult to treat, often spreading rapidly and resisting traditional chemotherapy and radiation. Then came immunotherapy, specifically a type known as checkpoint inhibitors. These drugs work by releasing the brakes on the immune system, allowing it to recognize and attack melanoma cells more effectively. Clinical trials showed astounding results, with patients experiencing dramatic tumor shrinkage and improved survival rates, even in advanced stages of the disease. The success of immunotherapy in treating melanoma was a turning point in cancer treatment, demonstrating the power of harnessing the body's own defenses to fight cancer. It marked a paradigm shift, moving away from simply attacking cancer cells directly to empowering the immune system to recognize and eliminate them. This breakthrough has not only transformed the lives of countless melanoma patients, but has also paved the way for exploring immunotherapy's potential in treating other types of cancers, fueling a wave of research and clinical trials that continue to yield promising results. Section 3, from grim prognosis to thriving life, a testament to progress. The impact of these breakthroughs is best illustrated through the stories of patients. Take, for instance, Sarah, a young mother diagnosed with advanced melanoma. Given a grim prognosis, Sarah enrolled in a clinical trial for a new immunotherapy drug. What followed was remarkable. Within weeks, Sarah's tumors began to shrink. Over time, her scans showed no evidence of disease. She returned to her life, her family, and her passions. Sarah's story is not isolated. Similar stories of hope and triumph are emerging worldwide. These stories remind us that progress is being made. Section 4. The future is now, a wave of innovation. The breakthroughs we see today are not the finish line, but rather a springboard for future advancements. The field of cancer research is dynamic and constantly evolving, with scientists and clinicians working tirelessly to develop even more effective, targeted, and less toxic treatments. The future of cancer treatment is being shaped by a convergence of disciplines, from genomics and immunology to nanotechnology and artificial intelligence. Researchers are delving deeper into the molecular intricacies of cancer, identifying new drug targets and developing personalized therapies tailored to an individual patient's unique tumor profile. We are on the cusp of a new era in cancer treatment, an era where cancer is no longer viewed as a death sentence, but as a chronic, manageable condition. The breakthroughs we are witnessing today are just the beginning, the first ripples of a wave of innovation that promises to transform the landscape of cancer care for generations to come. Your journey to understanding, from chemotherapy and radiation therapy to advancements in immunotherapy and emerging therapies, knowledge is power. Understand cancer treatments to navigate this journey. Ask questions, seek reliable information, and engage with your healthcare team. You are not alone. There are resources and support networks available. One theme has emerged: hope. From immunotherapy successes to emerging therapies, the landscape is evolving. Breakthroughs offer new possibilities and hope. Stay informed, engaged, and hopeful. If you found this guide helpful, please like this, subscribe, and hit the notification bell for more updates. Thank you for watching.